Go ahead, ma'am.
Okay. So good afternoon, everyone. I'm Dr. Sayali. I'm the fertility specialist at Oasis Fertility Pune at the Kharadi Center. So I welcome you all for today's Facebook Live session. And today we are going to explore some of the most common misconceptions or myths that are related to the IVF treatment. So today we are living in a society where most of our women are not aware of their infertility. They come to know that they are infertile or not able to conceive only, when they're requiring treatments like, IVF or in vitro fertilization. That is when they have reached the advanced stage, when the egg reserve has declined, or whether there is no other option by which we can help them out. So, in our previous sessions, we have dealt with the misconceptions or the myths that are related to the IVF treatment, the IVF success, the pregnancies that are achieved through IVF, and the babies that are born through IVF. So today in the session we are going to explore some other misconceptions that are related to the IVF treatment, and here are some of them. So the first is, most of the women feel that infertility will not happen to me. Like the woman feels that she's having regular menstrual cycles, they are having regular sexual intercourse, she's leading a healthy lifestyle, so she is not going to be infertile. But one has to understand that one in every 10 couple, is infertile. It's only when you try, try to start conceiving, or, when you're not able to achieve pregnancy after 1 year of, unprotected sexual intercourse, then that is a time when you should actually get yourself evaluated for your fertility potential. You should get yourself examined to know whether there is any problem, in which you will require some assistance. And I think that is the best time when we can, evaluate you and, guide you accordingly. Ki what is the chances of you conceiving by the natural method, or do you require any other method of treatment? The second common misconception or myth is that a female who has already conceived a child feels that I already have a previous child and therefore I cannot be infertile. So here you have to understand that the previous pregnancy just indicates your fertility potential at that point of time. So, able to conceive a child prior doesn't indicate that you're always going to be fertile. So maybe later on there might be some problems, such as some infections might have set in, that have, affected your tubes, that have caused blockage in the tubes, that have affected the endometrial lining, or maybe your age had advanced, your ovarian reserve or the quality of your eggs have deteriorated, or your husband's semen parameters have been compromised. So maybe because of this you might require, IVF as a method of treatment, or you might require certain assistance in your pregnancy journey. So there is something known as secondary infertility. So this is specifically a woman who had no problem whatsoever in trying to conceive her first child, but she can be infertile and she might require some assistance in conceiving the further children. The next common misconception is, a woman feels that I am having repeated miscarriages. I am able to conceive. I am not infertile. Now, here you have to understand that when a woman is having repeated miscarriages, she is unable to carry the pregnancy till term. So, there can be certain factors, such as, her body is not supporting the baby, or, there is some genetic abnormality, or the quality of her embryos is poor, that they are not progressing further. So IVF per se, with the help of maybe the genetic testing of the embryos or other factors, can help her continue the pregnancy, can help her attain her dream of, giving birth to a live healthy baby. So therefore, if you are having repeated miscarriages, if you're conceiving but you're not able to carry the pregnancy till term, you're not able to deliver the baby, definitely infertility treatment, can help you reach your desired goal. The next common misconception a woman feels is that I am very young, I cannot be infertile. Now, we all know that older women definitely have a higher risk of being infertile. Definitely, the quality of their eggs, or the reserve is on the downfall, and therefore they will have problems in conception. But there are some younger individuals who can have a premature ovarian insufficiency. Here, the ovarian reserve can be in a lower side, even if they're young. They can have some other factors that are, preventing the egg from meeting the sperm, getting fertilized and forming the embryos. They can have factors such as tubal blockage. They can have issues relating to the endometrium or severe infections that are, preventing the process of formation of the embryo, implantation and carrying the pregnancy. And therefore, in these cases, even if the individual is young and, she's suffering from infertility, she needs to take treatment further. Next common myth is an individual feels that I am totally healthy, I am physically fit, I'm taking care of my health, I work out daily, I, follow a very healthy lifestyle, and therefore it's not possible that my egg or my semen parameters are going to be affected, and therefore I am not going to be infertile. So you have to understand that there are certain conditions in which physical fitness does not play any important role. Definitely, if you are obese, if you have a sedentary lifestyle, if you have conditions such as PCO, or the motility of the semen sample is affected, in these cases, a healthy lifestyle, doing away with the addictions, proper regular meals, these can kind of improvise on your quality of the eggs, sperms, and can improve your chances of conception. They can improve your response to treatment and help you in getting pregnant. But certain factors such as blockage of the tubes, individual who has genetic problems, or individuals who has a declining ovarian reserve or declining testicular function, in these individuals just physical fitness is not going to play an important role, and therefore what is important is that these patients or these individuals should be timely diagnosed at the right point of time, so that we can help them conceive with their own eggs and their own sperms. The next common myth that is there is an individual who's having regular menstrual cycle, who's having regular unprotected intercourse, and feels that the male parameters are normal, they can take as long time as required to conceive. So here you have to understand that age and time are two important factors that are going to affect your overall fertility journey. Now here, if you're not able to conceive by unprotected sexual intercourse without any assistance for a period of 1 year, and you are having regular menstrual cycles, then here is a time when you need to get yourself evaluated. So you cannot wait for whatsoever time you want. You cannot take your time, because by the time you're not able to conceive, your age has advanced, you're not able to attain pregnancy. So whatever success we might have given you by the minimal interventions such as an ovulation monitoring, IUI cycle, or even an IVF cycle, we might not be able to give you at that point of time. Definitely when your age advances, when the quality of the egg or quality of the sperms deteriorate, maybe IVF will also not do justice to you, and maybe you might resort to the donor eggs or donor sperms. The next common myth that comes in mind of individuals is males cannot be infertile, as they know that females are born with a certain reserve of eggs and that get deteriorated as the age advances, and males are producing sperms every single day. This doesn't mean that males are not going to be infertile. Definitely, individuals who have a declining testicular function, who have severely abnormal semen parameters, very low count, motility, or there is damage to the sperm, increased DNA fragmentation index is there, or individuals who have got severe trauma to the testes which has kind of affected the testicular function, or individuals who have some genetic abnormality, individuals who have no sperms in their sample, something which is known as obstructive azoospermia or a non-obstructive form. These individuals will definitely be infertile, and they will require some form of assistance in the form of IVF to conceive. The next common misconception among the couples who are trying to conceive is that babies that are born through IVF will require IVF in the future. Well, this is absolutely not true. These babies have the normal fertility potential, just like other normal women or other normal men. They do not require IVF in the future. Their fertility potential is all normal, and if they tend to require IVF in future, it's all going to be because of some other factors and not because they were conceived through IVF. So I think these are the most common misconceptions that are in the minds of people who want to go ahead with the IVF treatment. many other factors, regarding the total IVF journey, the success through IVF, the pregnancies attained, and the babies born. We've already discussed. So I think this kind of covers up most of the doubts that are in the minds of people, and they shouldn't be following whatever the lay public is following. Definitely, if they have any doubts, if they have any misconceptions, do visit the fertility specialist so that we can guide you in the right way and we can help clear up all of these doubts of you. So I hope this session has been helpful to all of them who are listening out here. So this is all that I have from my side. Let us see if we have any questions which are coming over from our viewers. Okay. So the first question that's coming over is, do IVF medications have side effect? Now, do IVF medications have side effect? Here you have to understand that the IVF medications that we are giving you is basically to improvise on the quality of your eggs, the quality of your sperms. The injections that we are giving you, definitely higher doses of injections are given over a period of 10 to 12 days. It all depends upon how the woman is taking it. What is the tolerance of these individuals. So long term side effects of IVF medications is not there. So a little bit of acidity, little bit of bloating sensation, and whenever your follicles are going to grow, there's going to be distension, a mild discomfort in the lower abdomen. These side effects can be there, but nothing major and nothing that's going to be in the long run. Okay. So the next common question, I think this is one of the myth that we've already covered in our session, is, can IVF babies conceive naturally? Yes, IVF babies can definitely conceive naturally. Their fertility potential is just going to be like the normal male or female that is there. Okay. So the next common question is, does IVF cause problems later in life? So you have to understand here that IVF is just a method by which we are trying to attain pregnancy. If you're not able to conceive naturally, this is just a method by which you improve the chances of you conceiving. But babies that are born through IVF, maybe you can consider that if twins are born, they might be born premature, they might be born early, they might be of low birth weight, but there is a catch up of birth weight later on. Their growth development is absolutely similar to the normal babies, and the risk of abnormality is very similar to those that are born through natural conception. So therefore, IVF is not going to cause any problem later on in the life of the babies that are born. And for the women that are going through the IVF treatment, definitely a single or two cycles of IVF is not going to cause any problems later on, because we are not giving you an extensive treatment out here. So we are just making use of the follicles that are going to be coming in that very cycle. So there are going to be no major problems later on in life. Okay, so thank you everyone. I think this is all that we have from our side. So if you have any queries related to the topic, or if you have any help, or if you want any help needed, you can dial the helpline number that is given below, or you can reach us physically at any of our two centers, that is Oasis Fertility at Kaspate Vasti at Wakar, or at Arisa Avenue at Kharadi. Thank you.